thank you for being part of my presentation tonight. And I do want to give a special shout out to Veronica for being my preceptor this summer. Thank you very much. So my name is Scorpia Williamson, and I'm doing my evidence-based practice presentation on reducing the risk of CLABSI for oncology nurses. Okay, so the rise in central line infection is prevalent in blood cancer patients whose primary diagnosis is leukemia and lymphoma. Most patients that are treated for blood cancer usually get a central line placed, and those central lines are usually used for IV antibiotics, chemotherapy, maintenance fluids, and blood transfusions. Central lines do require special care in order to protect the patients from getting infections. Registered nurses are on the front line of preventing these infections and contributed to 58% in Class B based on a study that occurred between 2001 and 2009. So what is CLABSI? Central line associated blood infection, or CLABSI, is a preventable issue that's been on the rise in the healthcare industry. CLABSI can potentially lead to sepsis or even death. It occurs when germs enter the bloodstream through the central line. It's usually bacterial or viral, and signs and symptoms are usually fevers, or sometimes there'll be pain around that insertion sign. Okay, so who's at high risk? Leukemia and lymphoma patients are at high risk for infections because they're immune suppressed. They're usually neutropenic, ANSI is usually less than 500. They usually require prolonged use of the line. They typically have poor nutritional status, which put them at an increased risk. And for the nurses, the deck is usually stacked against us to try to prevent these infections from happening because of the status of these patients. The effect of CLABSI: they're costly, they can exhaust the healthcare system, and they increase the patient's stay in the hospital up to 20 days. They are preventable with a team effect when peer-to-peer process can be made available and attainable goal in a clinical setting. The implementation of the CLABSI bundle and a checklist with specific step-to-step process to ensure safety when caring for these patients is a good way to avoid these infections from happening. What's the best practice to prevent CLABSI? Can the use of the CLABSI bundle reduce incidence of central line associated bloodstream infection in immunosuppressed blood cancer patients with their primary diagnosis being leukemia or lymphoma with the central line compared to not implementing the bundle? So there are 5 key components to the central line bundle. The first one is hand hygiene. Second one is maximum barrier precautions. The chlorhexidine skin antisepsis, optimal catheter selection, and daily review of the line necessity with prompt removal of unnecessary use of that line. Okay, so proper hand hygiene. Soap and water or alcohol-based, waterless. Cleaning should be used before and after you touch that line. So whether you're just getting ready to flush a patient or reconnect at the hub, you definitely want to wash your hands first, apply your gloves, and scrub the hub with alcohol before proceeding. Maximum barrier. So this has to do with when the line is actually being inserted. You want to make sure that the operator has on their full sterile gear. They should be wearing hats, sterile gown, gloves, sterile field with only a small opening to where that actual insertion site is. And also when you're doing dressing changes, you want to make sure that you're wearing a mask and you're also wearing your sterile gloves. Chlorhexidine, the antiseptic. So evidence-based practice has proven that the use of chlorhexidine does help prevent central line infections. So we're using that to scrub the site before they actually puncture the skin, because we all know that your skin is your first line of defense. And when that is broken, it does introduce infections. So using the chlorhexidine and scrubbing the site does help. Optimum site selection. Research shows that the subclavian vein site is associated with lower risk for infection, so it is the optimal site to choose. You definitely want to review the daily uses of that line. Is that patient still a candidate for our central line? Research does show that the longer that line is in place, the higher the risk is for an infection, and just removing that line does reduce the chances of infection. So you don't want to keep the line in place any longer than it needs to be in place. The daily checklist guideline. So you want to make sure that that dressing is clean, that dressing is intact, that is labeled properly. That way you know when the dressing was last changed and when the next due date of changes. You want to make sure that that insertion site is clean and free of infections. You want to make sure that you're using the appropriate disinfectant caps, that lumens are flushed per protocol. Some hospitals will have you flush it every 8 hours. So you want to make sure that the lumens are being flushed, that there's not any blood residue that's left in there. And then you also want to make sure that the tubing is replaced, whatever that facility protocol is, that's being done appropriately as well. And that the patient is doing the daily bath with the CHG soap, and that's also documented appropriately. That way we know that that was in fact done. So action plan. When it comes to implementation, usually a team is something that you need to form in order to help with implementation. And it should be an interdisciplinary team that can review the current trend of infections, or to see how many numbers we have. This is something that could probably take about 6 months, from beginning from doing your research to working with the clinician to educating the staff to actually implementing the bundle. Education. Nurses do need to be educated on the research that has been done on central line infections, the cause and the effect of them. So they should be provided with an initial education and also provided with ongoing education. And this could be done by doing online classes, skill check-off, and audits to make sure that the nurses are in fact doing what they need to do to help protect their patients from infections. Accountability is the key for success. Nurses need to be accountable to themselves. They also need to be accountable to their coworkers and as well as the patients. I don't think nurses should be babysat. Once they know what the checklist is and what the bundle is, and that's what's being used, and they should do so accordingly. But nurses do need support, so there are going to be super users that are on the floor, and they're going to work with clinicians to make sure that nurses are getting the education that is needed. They're going to also review the hospital policy and the scope of practice. They're going to provide a checklist of the 5 components, that way nurses know exactly what they are, and also a daily guidance, so nurses know exactly what they should be doing on a daily basis. So what's the benefit of using the bundle and the checklist? It provides a physical checkpoint for compliance. And it can be used during handoff reports, so when nurses are reporting to each other, they can say exactly what was done and what needs to be done within that 24 hours. It's a useful tool if there is a breakdown in compliance. So if the dressing wasn't changed within that 7 day, you can look back and see, well, look, this wasn't documented, or if the bath wasn't done, you know exactly where that breakdown occurred. And it does ensure that all components of the checklist is being met. So some important reminders: to be accountable to yourself, your peers, and to your patients. Reducing CLABSI is only possible with a team approach. From the site selection to the daily use, we need 100% compliance 100% of the time. That's the only way to actually reduce these infections. And the strongest solution to this problem is providing staff with support that's needed. So just letting staff know that we're all in this together. Initial and ongoing education is necessary, and training will be provided. So a little bit more about accountability. Be accountable for your own action. Be part of the team. We are all on the same team. We all share the same goal, which is to reduce these infections in our patient population. And be committed to working together in order to accomplish these goals. And these are the references. Thank you.